Dr. Theresa Tam is Canada's Chief Medical Officer of Health and really the face of the national COVID-19 response in this country. And she joins me now. Dr. Tam, first of all, thanks for taking time to speak with me today. It's good to see you.
Good to be here.
Look, we see spiking numbers in Manitoba. The numbers remain high in other provinces. And I guess I'm wondering at this point, how close do you think we might be to the need for another heavy lockdown like we saw at the start of the first wave?
Well, I think, the resurgence, which is in fact in most provinces, apart from sort of the Atlantic and the territories, they are experiencing a resurgence. And so all medical officers are concerned about that. Many of the acceleration, it was initially driven by younger adults, the 20 to 29 and up to 39-year-olds, but is now beginning to also impact the older age groups, which are at higher risk. So yes, we are concerned, but we can do something about this. And what we're trying to do, my colleagues on the ground particularly, is to have a balanced approach so that you're not using broader public health measures and try as much as possible to use more targeted approaches. But of course, a really difficult and fine balance.
So at what point, if we, are you satisfied with what you see today, for instance? There are still high case numbers, but some suggestion the trend might be actually coming down a little bit. Are you satisfied by what you see today? Or are you concerned that we're not close to where we need to be yet to get this thing under control in a second wave?
Well, I think right now we need to double down on our efforts. So we've seen that Ontario, for example, and Quebec, in some of the hotspots, they've instituted some more measures. And we are hopefully seeing some of the effects of the slowing down of the resurgence in those areas. But other areas of the country are escalating, as you've just said, whether it's in the prairie provinces or in other hotspots, even in British Columbia and others. And so, the key is to act fast, because if you act faster, you can come out of the resurgence that much faster as well. So some of the concerning aspects would be whether the public health system is able to keep up with not just the testing, but also the contact tracing and then the isolation. What we're asking people to do and really be conscious of is to limit contacts that are outside your household or that's not necessary. I mean, people do need to go to school, do need to go to work, but try to minimize contacts because it is so difficult for public health to keep tracing a lot of people. And then when they can't keep up, as you've seen in some areas of Quebec and in Ontario, that's when you're going to get into major issues with community transmission and resurgences. So that is the concern.
You suggested to Canadians last week as you delivered your annual report that they, as you just touched on, they need to reduce their contacts by 25% to try to flatten the curve of this second wave. The Manitoba Premier today, he's calling on residents in that province to cut contacts by 75%. And he's considering an evening curfew in Winnipeg to shut down gatherings. What do you think of that kind of approach? Do we need curfews now to force people to follow the rules?
Well, I think it depends on your knowledge of your local population and who's impacted. So I can't really speak for, Manitoba or Winnipeg, but it depends. I believe that they are seeing younger populations. Some of them are linked to certain settings. So I think that has to be adapted. As to how much of the restrictions need to be done, the earlier communities get community transmission slowed down, the less of these broader measures you have to take. But I have to say that it is important to take those decisive actions and do it fast. And so when I said 25%, that's for the whole country at this point in time.
Right.
So depending on your local setting, you may need to do more. But that's up to the local medical officers of health.
I want to ask you about this report today from Duke University that Canada has secured far and away more vaccine doses per capita than any other country, and that's put developing countries at risk of perhaps not getting enough of the vaccine, and that's contrary to what Canada promised, as you know, by signing on to the COVAX facility to ensure equitable access to vaccines in all countries. Is Canada guilty here of hogging vaccines?
Well, I think our decision makers are trying to protect Canadians. That is uppermost in their minds. But by supporting and investing in so many different vaccines and providing financial and other supports to it, it's actually helping the global capacity as well. So I think that we're looking towards contributions to the COVAX facility that's already been made. But of course, if we don't know which vaccines will become successful, that's safe and effective. But if more is available than what Canada needs, then there's a way to help the global response as well. So I think you have to do both. You have to protect your population, but also some of this investment will benefit the global capacity investments. And as I've said in my report, no one's protected until everyone's protected. So
yeah, are you suggesting if we have more vaccine than we need, we would then distribute that to developing countries?
I think that's part of it, and that's why we're in the COVAX facility. But it's also about this unprecedented response, not just on the research side, but on the manufacturing and other readiness. If countries like Canada didn't have these agreements and didn't invest, then we wouldn't get the kind of acceleration in the capacity that we're seeing. So I think that's a contribution as well. But I think our policymakers are trying to protect Canadians, but at the same time, in parallel, investing in the global response.
All right. In your annual report last week, you called for a structural change in Canada across health, economic, and social sectors, better housing, better wages for low-income workers, improved conditions and outcomes for racialized communities who've been hardest hit by the pandemic. And I guess I'm wondering why you wanted to raise that now while people are trying to deal with a second wave of the pandemic. Why did you think it was important to put that notion and that thinking out there now?
Well, it's extremely important because we've seen that the pandemic doesn't impact everyone equally, but it also does affect everyone if some of us not well protected. So everyone needs to be protected. Just for example, long-term care facilities. That was a major impact in the initial wave. So we know that ageism, our societal support for seniors was not adequate. So that's important. It's not just the residents of long-term care facilities, but also the workers, many of whom, the personal support workers, people who clean our long-term care and hospital environments, they're poorly paid, they're in precarious jobs, often racialized and often women who have family to support, who needs to hold down several jobs. So as a result of trying to provide us with those essential services, many of this population inadvertently, given the virus being sort of transmissible when people are asymptomatic, for example, is inadvertently spreading some of the viruses and not being supported to have proper isolation, for example, because they live in crowded settings. So all of these are really important if you want to get the pandemic under control, but two is all the way through recovery. If we didn't have enough social economic support, many of people can't afford to stay at home when they're sick. They can't afford to, because they don't have sick leave, they can't afford to not go to work, which means that in some instances, they are not able to stay back when they're sick. So all of those supports are very important. And if you didn't have a home and you're living in congregate, crowded situations, you're less likely to be able to contain the virus. So I think the pandemic really shone a light on some of those systemic cracks in our system. And I'm suggesting that in the future, not just for the current response, is that if we want to be resilient and protect Canada from the next pandemic, then we have to take into account the social and economic dimensions and have a whole of society and interdepartmental and intersectoral response.
All right, Dr. Theresa Tam, thanks so much for your time today, and we'll talk again soon. Take care.
You too. Stay safe.